everybody, it's A Dog's Life with Angela Ardolino, and I'm really excited about my guest today because I want to say it was a little over a year ago that my guest, Jonathan Lowe, introduced me to, and you probably didn't even know it because I was on some webinar that someone else was hosting. I don't even remember, but you're the one that introduced Ozone to me, and I loved how easy you explained it for a layman like me. And I was so impressed with your presentation that I actually had our chief vet from CBD Dog Health, Dr. Zach Pilosoff, that everybody knows, go through your next training and event. And there's nothing more fun, and I think you probably see this on a regular basis, taking a vet who knows nothing about this, teaching them and letting them experience and see the results. And then what was awesome is that you changed and opened Dr. Zach's mind so much that he actually came the following year and presented, and you just had your presentation, which I attended, which was awesome. But Jonathan, hello, welcome. Thanks for being on the show.
No, my pleasure. I really enjoy this type of thing. So thank you very much for carving out some time to have me.
You bet. So how in the world did you discover Ozone and then decided this is what I'm going to do? Because I love telling these stories, because I feel like this is something, as you know, that existed overseas. People use it on a regular basis. We'll talk about what it just did in a hospital in Spain. But I thank you for bringing it and teaching our vets this. How did you get involved and how did you discover Ozone?
Yeah, well, first things first, I wasn't the first person to discover it. That was
in the
1700s.
And that's what I say. Hey, I didn't discover cannabis, so.
But yeah, that's tongue in cheek, obviously. So for me, my discovery journey was really, I started working with my dad in alternative medicine type things about 12 years ago. And we were working with human medicine. And at that point in time, I didn't know anything about ozone therapy. We were working with something called ultraviolet blood irradiation. And then we started going to conferences where they were talking about ozone therapy. There's a number of ozone therapy conferences throughout the world. So I got the opportunity to travel to a few different places and kind of hear about ozone therapy, and what we were doing at the time dovetailed real nicely with ozone therapy. So ozone therapy doctors were really our target audience, it turned out. And so after a few years of that, I recognized there was a complete lack of anybody providing ozone therapy equipment for animal purposes, for veterinary purposes. And so at that point in time, I thought, you know what, this would be a really cool thing to be a part of and to start working towards, to provide this treatment that has had some just incredible effects and has actually quite a bit of science behind it to veterinarians. And so I met a doctor right around that time. This was probably 2013 or so, whose name is Margot Roman, and she works in Hopkinton, Massachusetts, near Boston. And I call her the ozone evangelist because she just loves talking about ozone therapy. And she really encouraged me to take the plunge and to help support the veterinary industry, because again, nobody was doing it, which is shocking to me. That we can have a treatment that's been around as long as ozone therapy has been around, and yet there wasn't one company in North America that was dedicated to actually provided training and equipment to veterinarians to do this in a veterinary hospital, or, as you know, in a home sometimes.
Yep.
So
I want my listeners to listen to that, to hear that, because of course I love all of these alternative methods and medicines and techniques and things that exist and have existed for centuries, yet we don't know anything about it. And that is because our doctors and our veterinarians aren't taught about it in school. This is something that doesn't make it onto the curriculum. We all can have our reasons why. I believe when it comes to things like cannabis or colloidal silver, my theory is that these are things that occur naturally in nature, and you can't trademark them and make billions of dollars off of them. So since we can't do that, we're going to keep that from the public so they don't know about those things. And we're going to just talk about the things that get created, prescription drugs, chemical therapies, when these beautiful things exist in nature that we don't know about. So that's, as my listeners know, this is what we're constantly doing, going, here is something else that we can do that does not hurt our pet. It only helps them.
Mm-hmm.
So also the remembering that what helps us and works on us 9 times out of 10 is going to work and help our pets. So I love that you saw that opportunity and said, wait a minute, why isn't anyone doing this with animals? This could really help our animals. So tell us, how are the ways that it does help not only humans, but our animals? Like, what were you seeing that you went, wait a minute, if this is helping a person with cancer, it could help a dog with cancer?
Yeah, well, I remember going to actually a conference on cancer in Spain for ozone therapy and cancer, and this was put on by one of the organizations that's done a lot of work in the ozone therapy arena to kind of promote it and to get science, based evidence in front of us and all that stuff. And so that was really eye-opening to consider, how ozone therapy might be really a good adjunctive treatment to support our immune system, to cut inflammation, to oxygenate the system, which is hugely important when we're talking about cancer. And it's doing all these kind of root level things. It's not a symptom-based approach, which is extremely important to understand, because then you kind of know how that dosing or what it can apply to is very distinct from maybe what we see as a pharmaceutical based approach to medicine, where you take a pill for this particular condition and it's going to do this, and these are the side effects it's going to have, and all of those types of things. Ozone therapy is very different, and I saw that early on, and saw the benefit that it could be in something like cancer because of the things we just mentioned. And yet there was a lot more. There's a lot of other things as well, because it's really helping to I boil it down. I oversimplify, and I'll just say right here and now, that's true. I oversimplify this. So to get a more expanded understanding of what ozone therapy is, you're going to have to go to somebody like Dr. Pilosoff and hear the lecture like he gave at our Ozone Summit a week ago, which I was actually, I was thrilled about, and a lot of people were, because he really helped unpack some of the science and some of the biochemical reactions and the different things that are occurring in the body. And it was quite incredible to hear. However, when we boil it down and we consider how it works, I tell people, number one, oxygen is the most important nutrient we have. And if you want to prove that, hold your breath for two minutes here. Okay. So let's just do that, Angela, right now, you and me, huh? See how it goes.
Great. Well, when we go to the next commercial break, we'll do that.
We'll see who wins. Ready?
Well, I grew up in my pool in Miami, and I used to be the queen of holding my breath longest. So you may not be able to beat me.
No, I wouldn't. I guarantee it. And then we would have no interview left.
Exactly.
So we won't do that, but it very quickly shows you how important oxygen is. And it very quickly shows you we can live without nutrition for a while, without water for a while, without sleep for a while, without good mental emotion, state for a while. We don't want to, but all of those things, are important for health, but they're not as crucial as oxygen. And so as somebody ages and their mitochondria break down and their ability to create ATP, which is kind of like the energy for the cell, as that decreases, or if we have a chronically ill patient and their oxygen levels are just lowered because of that, you're going to have a sick person. You're going to have a sick pet. And because of that, we want to do something to turn this around, to slow down mitochondrial breakdown, to slow down, some of these things that aging just, it happens, right? And we all start to get wrinkles. We all start to lose hair, or, all these things, right? And none of us like it. But with ozone, one of the really cool things is we can actually help to slow that process down to a degree. And it's really through increasing cellular oxygenation, which increases energy, which has a cascade of effects. And again, oversimplifying, there's some other factors that are involved in this, but that's what I like to boil it down to, because it number one, it's true, and number two, it makes sense for us, and so that's where I would start, I guess, with
Awesome.
that whole.
And we're talking about ozone and what the heck it is and how it helps. And you kind of talked about, what it does or what our body needs. What I love is that I feel like our immune systems are this forgotten thing that we all have and that our pets have. I feel like, big pharma is always suppressing it or beating it up instead of supporting it. And I'm all about supporting it. I mean, this is what we all have. And if we support it, it'll take good care of us.
Mhm.
And as we age, degeneration happens. There's nothing we can do about it, except there are these natural remedies and things that we can do to support our bodies and our immune system. And when you have a sick pet, that is all you want to do. We shouldn't be suppressing their immune system. And, that's what happens with cancer. You don't end up dying from the cancer. You end up dying from something else because your immune system has been so suppressed and beaten up that you end up getting something else and dying from that. Am I right?
Yeah, I mean, oftentimes that's just the case.
Right. So tell us what happens, how it works. How do we get how does it go from being ozone to oxygen for our cells?
Yeah, great. So oxygen on steroids, I call it sometimes. I mean, and I know in the holistic world, right, we don't like the word steroids, but you get the idea.
Right. And also ozone, we always think of like, wait a minute, isn't ozone bad? Aren't we, so even that even confuses people. So
Absolutely. When I ask somebody, and I've done this at different student bodies in different places, what do you first think of when you think of ozone? Usually it's the ozone layer, number
Right.
one. And then secondly, it's smog oftentimes, because the element that they measure to see how bad the smog is in a city is ozone. And so it gets a bad rap. Now, in one way, it deserves that bad rap. And I'll briefly say why. Because ozone can damage our lung lining. So we don't want to administer ozone by breathing it in. That is the one way that it is dangerous to our health. If you're breathing in significant levels of ozone over long periods of time, that can damage your health, and it's not a good thing. So we avoid that. And that's why in a city, with smog, you don't want to, again, be creating lots of ozone and breathing it in. However, ozone in and of itself is very good if you're not breathing it in certain ways. And we'll answer your question, but we'll also talk about how to get it into the body as well, because there's a variety of ways that we can apply ozone, which makes it extremely versatile.
Right.
Which is one of the reasons I love it, because it's not just, hey, we can just apply it topically, or hey,
Right.
we can just infuse it into the blood. No, there's lots of different ways we can use it, which makes it very versatile and very valuable as well. So basically, what you're doing when you administer ozone, or when ozone is absorbed into the tissue or into the blood or somehow into the body, is that ozone immediately turns into peroxides and something they call ozonides, which are very very helpful for a few different things. We talked about the oxygenation factor a little bit and how it increases oxygen utilization. Now, it doesn't necessarily increase the amount of oxygen in the body, but think about this. You breathe, and every time you breathe, you're bringing in oxygen along with some other gases into your system, and your body is taking that and it's transferring it into the bloodstream around, and through the lungs, through the bloodstream around the body, and your body is absorbing that, and it's utilizing it to create energy. And it's utilizing it to keep us alive. And there's hundreds of different reactions occurring every second in your body to keep you alive. Well, if you breathe and you get oxygen into your lungs and then into your body, but your body doesn't know how to utilize that, or you don't have the right, you're sick and your cells aren't functioning properly. Even though you have oxygen there, it's not necessarily going to be using it. So where ozone comes in is it actually helps the body then utilize the oxygen efficiently and properly. It doesn't find then a secondary means to go around, the the way we were created to utilize oxygen and use a toxic means to produce energy. I mean, that can happen. And so when we infuse ozone into a patient in a safe way and in right amounts, it can actually help the body to do those things. And it also can help to initiate an immune response. So it's helping to stimulate heat shock proteins and interleukins and cytokines and different things within our body that are innate immune cells that are necessary to heal. And a lot of times in a sick patient, you have these different signaling cells as well, which help the body to know where to send immune cells and when to send immune cells to that location. And what ozone therapy has been shown to do is to increase something or stimulate something called NRF2, which is a signaling pathway. And it gets really complicated, and it gets over my head too, which is why I dumb it down, because I'm not smart enough to understand these things, number one. And number two, most of the people I talk to are not smart enough to understand these things, because not everybody has a brain like Dr. Pilosoff, that to be able to do that. So these signaling pathways are opened, and the body is stimulated to then bring the cells to the right location, these immune cells, to help heal the body and to help get rid of cancer, or to help, oxygenate it in ischemic area where it's oxygen deprived, or to help eradicate pathogens. A lot of people, and one more quick thing, a lot of people think of ozone as a potent sterilizer, as a disinfectant, and it is, but it doesn't work that way internally. So you're not sterilizing the blood by infusing ozone into it. The way that it works internally to get rid of pathogens is by initiating an immune response, so it's a secondary kind of response that actually helps to get rid of bacteria, virus, fungus, that kind of thing.
Like, is it a lot like, when you take cannabis, like even CBD is known to go into our body and convert some of our cells into natural killers that then go through the body? Does it help support those also?
That's a great question. And I haven't seen a whole lot of literature on supporting killer cells, killer T cells, and all those types of things, and how ozone might stimulate those. I wouldn't be surprised, but again, that's a little bit beyond, I guess, what I would feel comfortable commenting on, and I haven't seen a lot of that.
So what are you seeing the best results using ozone? Like, what is it? Who's a good candidate for incorporating this into their dog's regimen?
Yeah, great question. And I would, this is gonna make it a little challenging to kind of nail it down, but I would say, who's a good candidate for good nutrition?
Cool.
It's hard to answer that, isn't it? And that's why it gets a bad rap too a lot of times, because
So it's like taking an oxygen vitamin?
yeah, kind of, basically. I think healthy people and healthy pets could benefit from doing ozone therapy once a month, because again, you're helping your body utilize oxygen more efficiently. If there's areas where your immune system is being suppressed and you don't even know it, maybe being proactive about that would be a good thing. But that doesn't really answer your question very well. So I'm going to dive down a little bit deeper into that after having said that. We see that doctors are utilizing this in so many different things because of its versatility. But one area that we've seen some great results is pairing ozone with things like platelet-rich plasma or prolotherapy, or even stem cell therapy, to do injections for arthritis, to do injections for degenerative discs or spinal diseases. Now, that's not something you're going to do in-house, but
Right.
Those are some areas that have been hugely successful and helpful, because you're utilizing these other treatments alongside of ozone therapy, and you're doing a number of things. You're increasing the oxygenation to those tissues and to those factors that actually helps release growth factors and heal that area faster. The same thing is true of surgeries. So if you've had a surgery or a doctor is in the midst of that, you can actually help that area heal faster. Maybe you've had a pet that had one, by either lavaging with ozonated fluids around that area, or putting ozone oil or cream right into that area, you're helping it heal faster because of the oxygenation factor, also decreasing any infection possibilities.
So like when you put an inside of a oxygen chamber, what are those called?
Yeah, hyperbaric oxygen.
Hyperbaric oxygen chamber. So when you do that, like let's say your dog has an injury to its arm, and you want to, I know you can bag it, put the bag around it, and then you're putting the ozone in that bag, and it's helping it heal quicker, and it's kind of the same idea.
Yeah. And yes, in a way it is the same idea, especially in that particular case where we're limb bagging, we call it on the ozone side of things. So with hyperbaric oxygen, you're forcing a ton of oxygen into the tissue, into the plasma that's being circulated around the body. With ozone, we're kind of coming at a different angle. First, we're deactivating any pathogens topically in that area. And then secondly, we're helping the body, again, utilize oxygen more efficiently. So we're coming at it from a different angle. We're not cramming oxygen into the cells, but we are doing some of the same things.
Awesome.
So yeah.
Three vets, we're talking everything ozone, and some of you may have heard about this a little bit, especially those who are in the natural holistic world, especially on social media. I know those of us in the cannabis CBD world, we love this as a compliment. It's one of Dr. Zach's newest favorite things: ozone and medicinal mushrooms and cannabis. The three of those, we feel like we can, get rid of anything. And as my listeners know, I have a 9-year-old Doberman who was diagnosed 11 months ago with osteosarcoma, and we do ozone with her. Dr. Zach does it with her. She was his first patient doing O3, and I have a kit at home. So I actually have my very own O3 kit at home. It's a little different than what the vets have, but I can basically do just about anything here except for the blood thing, which I totally want to do. And this is part of, the holistic regimen we've come up. I'm looking at Nina. I realize I'm looking off to the side. So she has been breaking records. We have done no chemo, radiation, and we're supporting her with, of course, a ketogenic raw diet, CBD, THC at night, and ozone and mushrooms, a little bit of phytoplankton, and all these other wonderful natural things that support her own body to help fight this. And we've got no spread. It's still in her wrist, and she doesn't use it when running or walking, but uses it for balancing. And she's one of those dogs where you knew taking off a limb would make a huge impact on her life. So I wanted to see if I could not do that or wait as long as possible before I had to do that. So she's thriving. And I'm sure this isn't a surprise to you. I know you've seen case after case. What are some of the most amazing cases? I want to say the first time that I used O3 was with Dr. Jill Rubenstein, and she in New Jersey. Where is she again?
Gosh, I'm
no, California. I can't remember.
Jill Rubin?
Rubin. Sorry. Jill Rubin.
Yeah.
Sacramento. I was like, was that the California side or whatever? And she, I came into her practice and we were, doing CBD, and she's had a patient coming in where they've tried everything. And now they're here to see her, and she was doing O3, and I did it for the first time. I had no idea what I was doing, but we basically, put the ozone in a giant syringe, and we insert it into the rectum and gently release it. That's what we're doing with Nina. I'm hoping soon I'll go see Dr. Siegel so that we can do the blood thing. And tell him what the blood thing is, since I'm, of course, calling it the blood thing.
So we call it, well, the easiest way to remember is MAHT. MAHT, that stands for major autohemotherapy. And that's one of the ways we can do it is we withdraw a small amount of blood, we infuse ozone into that blood, and then we just put it back into the vein for the patient.
And what's happening when you do that to the blood?
Yeah. So basically, again, it's very similar to doing rectal insufflation. or subcutaneous ozonated saline.
So tell them what that is too.
Yeah, so those are they're various ways to get ozone into the tissue, and we'll start with major autohemotherapy. Basically, again, we drop a small amount of ozone, we infuse it into the blood externally, extracorporeally, and then we put it back into the patient. And we're just really getting ozone into the blood. I mean, it turns into peroxides and ozonides just like it does on the skin surface. But this is more of a systemic way to administer it. Same as subcutaneous fluids. So when we do fluids, we bubble, let's say, ozonated saline in a little glass jar out, on the table. And we just bubble ozone into that for a period of time. It saturates that saline with ozone, and then we can put that subcutaneously, let's say around a tumor, or a lot of veterinarians do it in acupuncture points.
Yeah, like Dr. PJ Broadfoot.
Absolutely.
Yep, she was the first one that told me about that and that she was doing that. Yep, and it's great because she even bottles it and sends it home, so that you can take it home and use it however you want. You can put it in their water bowl. How else can they use it? Can't you flush eyes if there's an eye injury? I love it.
Great for that, by the way.
Right.
So we were talking earlier about things that it works really well on. If you have any sort of ocular infections, it's a great way, just like ozonated saline drops is what it is. And you're just flushing or dropping that into the eye, corneal ulcers, different things like that. Great way to use it. We talked about rectal insufflation, which is a way to get it into the patient as well. It's not really for colon related issues so much. It could be but really it's a systemic way to introduce ozone into the tissue. And all of these things that's really what it's about. And sometimes it makes sense to do that locally. Let's say in an eye or in an ear canal, we're flushing it with ozonated fluids as well,
Awesome.
for ear infections. Or, let's say for tumor, we might inject around that tumor. But for a lot of things, maybe it's a systemic problem going on. We're an autoimmune condition or whatever. We're just getting it into the body in one way or another. And sometimes it's not really important which one you choose.
Awesome.
Yeah.
I can't believe it. I can't believe that we are out of time. And I'm sure everybody's like, well, wait a minute. How do I get more information? How does a pet parent, A, find a vet, or B, if they are interested in getting the system themselves or learning more about how it may be able to help their pet? And again, guys, the biggest, what I love most about this is that, I know I sound anti-pharmaceutical, anti-antibiotic. I just don't want you to turn to those things first, because they can wreak such havoc on our animals' bodies, especially when there's these natural alternatives that do nothing but get rid of the issue and then support their own immune system. So where can they find you and more information about O3 Vets?
Yeah, well, of course, o3vets.com is a good place to start. And info@o3vets.com. If you have any questions, you can shoot us an email. I'm sure you can contact Angela and she can point you in the right direction. o3vets.com/vets, VETS, is a map of the practitioners who are around. You can also find that right on our website if you forget what I just said. And unfortunately, there's not many of them. There's just not. There's a couple hundred tops in the US who are doing this. So the word needs to get out.
Right. And most of them are also doing CBD. So it's when you find one, these are the vets that we love the most. And I'm sure you're just like me, because they hear about something or they have a patient tell them about something or another vet, and they don't ignore it. They go, well, if this is working, I want to know more. Which is what my favorite thing about Dr. Zach is. He wants to learn. He wants to know exactly how it works before he even tries it, which is why we love these vets so much. So thank you for bringing this to them and training so many of them. And thank you so much for being on our show today.
Absolutely. My pleasure. One last quick comment is our Facebook group. So if you have, that's a good place for a pet owner, a pet parent, to go find more information. So if you go to O3 Vets, facebook.com/O3 Vets, that's our Facebook page. And we have a group linked off of that. That would be
an awesome group. Yep. Awesome. Thank you, Jonathan.
Thank you.